you very much. A very good day to you, fellow colleagues and the conveners of the conference from Texila American University. My name, as you heard, is Assam Musonza from Zimbabwe, and my topic that I'll be talking about today is the impact of prostate-specific antigen testing on incidence of prostate cancer cases in Zimbabwe. We start with our summary, just to indicate where we are coming from. There has been an increase in prostate cancer in Zimbabwe, so much that by the year 2004, it had become the leading cancer and cause of death in men. I'm just looking at my... the objectives of the study were to determine the impact of prostate-specific antigen testing on prostate cancer cases in Zimbabwe. We also wanted to determine the age range most affected by prostate cancer. And to enable us to do this, we used secondary data from our National Cancer Registry here in Zimbabwe. And over 5,277 patients' data over a 30-year period was retrieved and analyzed. Now, during those 10 years, the pre-PSA testing era, which is from 1986 to 1995, and also included 20 years of post-prostate-specific antigen testing, which is from 1996 to 2015. There was a significant difference between the pre- and post-testing eras. The most affected age group was the 64 to 78, with a median age of 71. There is obviously a direct relationship between the introduction of prostate-specific antigen testing and the increase that we see in PSA cases in Zimbabwe at the moment. Now, so what? The sudden increase in these cases, we wanted to know whether it was really due that it was a natural phenomena that we have got so many cases in Zimbabwe, or it was because of the testing that we were doing that was also picking up indolent cancers, slow-growing cancers, which normally you wouldn't pick up. Just as a background to that, in the US and Europe in the 1980s and 90s, when PSA screening was started there was an increase in prostate cancer cases, which leveled off, and mortalities also came down at the same time. In America, there are more cases of prostate cancer in the African Americans, who we obviously share some common genetic origin. We wanted to know whether this was also the case here in Zimbabwe. We also wanted to rule out the role of PSA testing as the reason for the increase that we are talking about. Because of PSA testing, there is also the danger of overdiagnosis and overtreatment, which could be a problem. Hence, we wanted to find out the impact of PSA testing. Accessibility to testing and knowledge about prostate cancer is obviously increasing in our population, and we wanted to see whether these were also factors. Now, considering the above issues, the determination of the most affected age group and the impact of PSA testing would enable focused research on risk factors and also the genetic aspects of the disease. Now, the methods that we used, the research design, it was obviously a quantitative retrospective cross-sectional study, which was using secondary data from our cancer registry. This involved retrieving histology-confirmed prostate cancer records, which we retrieved from the registry, and the data was grouped into the year of diagnosis and also the age of the patient. And we also grouped that same data into the pre-PSA testing era, which, as I said, it was from 1986 to 1995. And the post-PSA testing era was from 1996 to 2015. We used GraphPad 7.03 we used that statistical tool to analyze the results. Now, the results that we obtained, out of the 5,277 PESA questions that we retrieved over the 30-year period, there were 1,191, which is 26.2% from the pre-PSA testing era. And the next 10 years saw us having 37%, which is 1,955 patients in the post-PSA era, 1996 to 2005. And the last post-PSA era of 2006 to 2015 saw us with 40.4% of the patients, which translated to 2,131 patients. Now, the age range for all the cases, they ranged from 9 to 99 years. There was only one case of that 9-year-old, which we couldn't verify whether it was really 9 years. The median age for this group was 71, with the interquartile range of 64 to 78. And the numbers in terms of age groups, under 40 years of age, there were 26, which translated to 0.5%. The 41 to 50 years age group, there were 116 cases, which was 2.2%. The 51 to 60 years of age group was 703, which translated to 13.3%. And the over 60 years of age translated to 4,432 patients, which was 84% of all the patients. I don't know what has happened to my graphs. They are not showing, but basically they were showing the age groups and all the things that would have shown there, and also indicating the number of patients in each particular age group. Coming to the discussion, the median age, as I mentioned earlier, is 71, which really matches quite a lot of other studies that have been done elsewhere. The one that comes to mind straight away is the National Board of Health and Welfare in Sweden, which has got a median age of 69. And our range was from 64 to 78. This confirms the usual held idea that prostate cancer is a disease of the old. 84% of our patients fell in the 64 to 78 age group, and would then indicate that is the most affected age group. Any screening that we might want to do would obviously benefit the 45 to the 60-year age group, for the simple reason that most of the cancer tumors are slow growing, and if you can catch them much earlier in your 40s, early 40s, you will be able to deal with it earlier. After 60 years of age, it now comes to the age which is near to the age that is most affected, and it might be a bit too late. The introduction of PSA testing has resulted, as you saw, in the near doubling of the initial phase from 1,191 to 1,955 in cancer cases. There was a significant difference from the pre and post eras with when you compare the 10-year periods from 1986 to 1995, the p-value there was 0.0077, and the comparison between 1986 and 95 and 2005 to 2015 was 0.0044 respectively. There was no significant difference when we compared statistically the two post-PSA testing 10-year periods. The p-value there was 0.826, which is not significant. In conclusion, is again to reiterate that the most affected age group in our country is 64 to 70 years of age. We've got a median age of 71. Prostate cancer obviously affects the old men aged 60 and above. The introduction of PSA testing in Zimbabwe, according to this study, could account for the sudden increase in the prevalence of prostate cancer in our country. The limitations and recommendations. The first limitation is the use of secondary data. Secondary data is usually collected. In this case, this is a registry which was collecting this information for national purposes, for statistical purposes, planning and policy issues. It was not meant to answer the questions that we actually came up with. And obviously there is also missing information like treatment and outcomes, so you were not able to do those things when you are using secondary data. More research and collaboration with other groups around the globe is recommended to figure out why we are having such a high percentage of prostate cancer cases, despite that some of the increase has been caused by the prostate cancer specific antigen testing. There is also need for more awareness in men about prostate cancer. You get situations where men might not even know where the prostate gland is. So there is need for men to be aware and some of the risk types of behavior and reasons why this comes to us, and do those things that might be necessary to avoid prostate cancer. And those are the references that we used. It's just part of the references that we used. Thank you very much.